The AMI cardiac output monitor measures cardiac output and blood volume minimally invasively by sensing the fluorescence of a dye injected in the bloodstream and circulated through the hemodialyzer. The amount of blood pumped by the heart in 1 minute is an essential indicator of cardiac health, and monitoring its level can provide a very early warning of the onset of hypotension in dialysis patients. The AMI cardiac output monitor can be attached around the circulatory lines of the dialysis unit without any alteration of the current hemodialysis settings. The procedure: a small bolus of indocyanine green dye is injected into the venous side of the dialysis circulation lines. This dye is very safe, used in other medical procedures, such as ocular imaging or cardiac dye dilution densitometry. This dye is FDA approved and has been used by hospitals for more than 40 years. The dye travels through the body, enters the arterial network, where it is detected on the arterial side of the dialysis circulatory path. The device is an optical element comprising 2 optical fiber cables and a receptacle for the circulation line. This device is self-calibrated using a novel patent-protected method. The dye that flows with the circulating blood is illuminated by a near-infrared light attached to the probe. The light causes the dye to fluoresce. The fluorescence intensity is recorded. The dye bound to blood protein is eliminated by the liver and allows the measurement to be repeated as frequently as every 5 minutes. Absolute cardiac output, stroke volume, and blood volume are calculated from the recorded fluorescence trace using the well-established dye dilution theory. AMI's technology can be packaged into a plug-in module that is inserted into the hemodialysis system. The measurements can be displayed on the current system screens, where other patient dialysis information is recorded. Hypovolemia and ensuing hypotension complicates up to 20% of hemodialysis treatments. AMI's technology provides early warning prior to the onset of hypotension. The cardiac output and stroke volume start showing downward trends much earlier than that detected using systolic blood pressure. The AMI cardiac output and blood volume monitor provides improved patient safety and comfort by detecting the onset of hypotension significantly earlier than systolic blood pressure, the current practice. This is minimally invasive, self-calibrated measurement from which one can derive also stroke volume and systemic vascular resistance. This method is in pilot human studies, showing robust results, and AMI is ready to license this technology.